All right. Hi, everybody. I'm Lisa White, and this is Dr. Greene with Conceptions. And he was my fertility doctor here in Denver. And we have been meeting a few times and really exploring the idea of having some conversations around clinical research, just the latest information that I feel like would be valuable information for all of you to know. We're looking at calling this Clinical Conversations with Dr. Greene and Lisa White. I'm also a clinician. I don't really share a lot about that, but I'm an occupational therapist as well as an IVF mentor. And Dr. Greene, can you tell a little bit about yourself?
Yeah, I also have successfully been through fertility treatment with my own wife and have a little bit of experience on that side of the desk. I think that really has sort of enhanced my own experience, both managing as well as going through the process. Been in practice now for 25 years and kind of still freaks me out a little bit whenever I say that, but you know, things are changing constantly. I mean, every 2 years I feel like what we're doing is pretty radically different from what we were doing a couple years before. So, you know, even this far into my career, I'm constantly learning, constantly changing, and I think something like this gives us the opportunity to sort of share that emerging knowledge and also target it so that people can look at the topics that are most interesting and relevant to their experience.
And I know Dr. Greene is very much into the science of all things fertility, and we've been meeting a few times, and he has shared kind of, you know, doesn't see as many people interested in the science behind fertility. And I told him I disagree. I think people want to know this information. They need to hear this information. So I'd like to hear comments below if anybody can chime in. And what topics are you interested in hearing about? What concerns or questions do you have? Dr. Greene is super knowledgeable, and we're going to be sharing some topics in the coming weeks. Want to just get your input. What are you concerned about? What do you want to learn about? And drop those questions below so it can help kind of guide us in having these conversations. So you want to add anything else?
Yeah, you know, it's funny because we do live in an era where sometimes people think opinion is as important or sometimes more important than what we're actually able to research and prove scientifically. And, you know, I'm someone that truly values individual opinion and theories, but at the same time, I also feel obligated to investigate because, you know, typically if we don't have a theory, we're not able to actually test a theory and see if it's true or not. And in the absence of that, we're just kind of running around trying stuff, and sometimes it works and sometimes it doesn't, and it's not a good way to give advice. So I think, you know, I'm very respectful for the fact that we each want to choose our own path. But to me, I think it's important that we help people choose a path that at least has enough science behind it that they could create realistic expectations.
Yeah, that's wonderful. So we're here for you, provide value, provide information, and look forward to supporting you all on this journey.
Yeah, thanks for the opportunity.